Gynecomastia, the medical term used to describe the development of breast tissue in young boys and young men, is at the center of my conversation with board-certified plastic surgeon Dr. Babak Dadvand. I'm Michael Reel, and this is ReelUrbanNews.com. Dr. Dadvand, what exactly is gynecomastia?
So Michael, gynecomastia comes from the Greek terms gyne and mastos, which literally means female breast or feminine breast. And it's a condition that affects some men, and it literally means that their breasts have a feminine shape. And most men have either too much breast tissue or too much fatty tissue or both. And that contributes to having more of a full chest or a feminine looking breast.
What is the fatty tissue? What causes that? Where does it come from?
So interestingly enough, I see men coming in with gynecomastia of all different causes. The funny thing is, most often we don't know the cause. It's something we term idiopathic, and that's usually the explanation in half the guys. But there are certain known causes, certain medications, for instance, like prescription medicines, antidepressants, anti-seizure medicines, some hair restoration medications like Propecia and so on. There are other things that are more directly responsible, like taking steroids. So I see a lot of people who are really big into fitness who take steroids or testosterone boosters who can get it. There's also things like hormone imbalances, like endocrine problems that need to be looked out for as well, because you want to also make sure that you're not just treating the gynecomastia, but any underlying issues that could have been caused that could continue to be an issue after surgery.
We know that when women have challenges of the breast, they notice things. If it's a lump or possible growth, what do men notice on their chest before they come to you?
Right. So with gynecomastia, there's a whole range of symptoms. Most men don't have symptoms such as pain, and really it's the appearance that bothers them the most, but there are certain men that have an exquisite amount of tenderness or pain. And just like a woman, for instance, who's going through her menses and their breasts get sore, well, if you have too much breast tissue and circulating estrogens, that can make their chest sore, their breast sore, to the touch, to hugs. And so in a certain percentage of men, they come in with a lot of pain. But for the most part, it's not painful, but it is very hard to walk around with a full chest. And these guys go through a lot of means to kind of camouflage. So they're wearing multiple layers when it's 90 degrees outside. They sit hunched, they wear dark shirts or shirts with pockets or shirts with patterns. These are all little tricks that they use to kind of to camouflage their chest. And that's the number one thing that they say. They just want to be done with having to go through all these measures just to be able to leave their house and not think about their chest.
It's also troubling from a psychological perspective.
Absolutely. I think that's probably the biggest issue. Unlike women with large breasts who can have real physical symptoms like neck pain and back pain, men with larger breasts don't necessarily have that, but they have a lot of psychological or self-esteem issues. They can't go to the beach. They can't take their kids to the pool and be active with their families. And we live in Southern California where it's nice weather 10 and a half, 11 months out of the year. And so not being able to live your fullest active life is a big issue in a lot of these guys.
When we kind of first started hearing about gynecomastia, I know we were hearing the effect that it had on young boys and teenagers. Is that still a problem? Is that when it kind of captures the male body?
Yeah, so a lot of patients that I see in my office, I ask them, when's the first time you noticed it? And a majority of them say during puberty, and there's something to it. There are some studies that show that up to 50 to 60% of boys going through puberty exhibit some form of breast growth or gynecomastia. Now, the thing is, in over 98% of them, it goes away after a few years. And so I see a lot of teenagers in my office who come in and I ask them and their parents just one question: how long have you had it? If it's been less than a few years, I choose not to operate on them because in most of them, it's going to go away. However, if they've had it for over 3-4 years and they've had a normal workup otherwise and normal hormone levels, then it's not going to go away most likely. And you don't choose not to operate on them just because they're teenagers. Teenagers are already going through a lot of issues with adjusting to social cliques and being bullied, and you want to make sure that you're not ruling out surgery for them just because of their age. However, you want to make sure that there's still not going to be that 98% that goes away on its own, and avoid doing an unnecessary surgery.
What do you tell parents to talk to their young men? What should they say?
Well, I think if a parent has a child who is going through these changes in like puberty and is developing gynecomastia, I think they should tell them, one, this is not an abnormal thing. This is a normal thing that happens to some boys going through puberty, but we will go get it checked out. First of all, they typically go to their pediatrician first, and if everything works out as far as blood tests and exam, then we just recommend waiting to see if it goes away. And if it's not going away after a few years, that's when I come in. And most of the time when teenagers are coming in, their parents are supportive. They're in the room during the examination, and looks like there's been an open dialogue.
And that dialogue has to be probably pretty significant, I would imagine, with you.
Absolutely. I think the dialogue, well, one, just because they're minors, they need parental consent to even go through with an operation. So obviously a parent has to be able to give consent for their child to have the surgery, so they need to be aware of what that surgery is, what the risks entail, what the benefits are. And so in my practice, I need to be on the same page with not just the patient, if they're a minor, but also their parents.
And so now that we have established that there is a surgical procedure, what does that consist of?
Yes, it's not a cookie-cutter operation, and I think that's where the mistakes are made. You can't do the same surgery in everybody and get consistent results. So what I do is when I take a look at someone, I'm looking at four things. I'm looking at, do they have excess fatty tissue, excess breast tissue, excess skin, and what their nipple position is. And depending on what combination of those four things they have determines the best technique. And I really go to great lengths to tailor the technique because you can't do the same surgery on everybody.
What is a typical surgery time?
So the surgery typically is done under anesthesia, and depending on what needs to be done can take anywhere between an hour and 3.5 hours. Some of the more extensive gynecomastia surgeries where I'm dealing with not just the excess fatty tissue, but the breast tissue and the skin and nipple position can take maybe even a little bit longer, 4 hours, 4.5, because there's just a lot of work that needs to be done, a lot of suturing. But the standard surgery, I would say, is about 2 hours, 2.5 hours.
Now, is this an outpatient surgery procedure, or is this a overnight or a couple nights stay in the hospital procedure?
Yeah, so regardless of which surgery I'm doing for treating the gynecomastia, it's always an outpatient surgery, which means that they come in, they have the surgery under anesthesia, and then they're in the recovery room for about an hour. Now, in order to make sure that it's an outpatient procedure, I have all my patients go through medical clearance beforehand, and that just ensures that they're medically safe and have a low risk for the anesthesia. There have been a few times where I've done it in the hospital for patients who maybe have some other medical issues going on and we just want a more controlled setting. But even in those cases, those patients have gone home the same day. So technically, even that's an outpatient procedure.
How common is this surgery becoming?
It's interesting. If you asked me this question 5 years ago, I would have answered it very differently. I think now this surgery has become much more common, and I think it's for different reasons. I think it's a variety of things have led to the increase in this. One, obviously, is public awareness, and so there's a lot more information on the internet. There are forums now for men to talk about gynecomastia, but I think there's also an overall trend towards men getting plastic surgery or plastic surgery procedures, whether it's surgical or non-surgical, such as injectables. And I think there's just a cultural shift as well as making this less stigmatic and more kind of open to not just women or Hollywood elite, but to the general population, and more specifically to the male population. So I think those two things have led it to become a much more popular procedure than it was even 4 or 5 years ago.
Speaking with your colleagues before we started, they were sharing that the majority of your patients are male. In addition to the gynecomastia surgery, what other kind of surgeries are men having that you perform?
So yeah, I perform a variety of procedures on males, just not just surgical, but also non-surgical. Of the surgical, a very common one is liposuction, six-pack abs, which is creation of six-pack or eight-packs on men, and that's a procedure that's very tailored to having the right patient. You can't do it on everybody. Other patients, other surgeries that I do are things like tummy tucks on males, or facial procedures like facelifts and rhinoplasty and eyelids. So yeah, I think from a surgical standpoint, those are the common ones. Of course, there are non-surgical procedures too, like Botox and fillers, and men are just as prone, if not more so, to getting lines on their face as women, and they come in. And like I said, the stigma has kind of gone down for having these kinds of procedures. It's not a matter of changing the way you look. It's trying to rejuvenate, and whether it's to still be active in the workforce and maintain competitive level in the workforce, or just feel better about yourself. Men are finding themselves in the plastic surgeon's seat much more commonly now than before.
It's almost like a household thing now.
It really is. And if you think about it, I mean, Botox, for instance, has been on the market for almost 30 years now. So it's not a medication or a procedure that just came about a few years ago. We know the long-term effects and potential issues with it. And really, it's in the properly trained hands, it's a very safe and reproducible treatment.
We're in Hollywood.
Right.
And I'd say with the past 5 or 6 years, there have been several shows dedicated to plastic surgery. We've seen all the talk shows. We see commercials for Botox and other cosmetic surgical procedures. What's the effect of social media in terms of plastic surgery and making it a lot more common?
Yeah, I think it's you touched on a really important point, and I think that's really raised the awareness in society as far as the acceptability. And I think there's a sentinel time where that really took off, and I think that year was 2007. And there were plastic surgery shows before that, which kind of overall increased the awareness in the public's eye and mind about plastic surgery procedures. But 2007 is when the smartphones started to become more popular, and being able to have the world at your hand, at your fingertips, and being able to go on Facebook or Twitter or Instagram and see people having procedures done and check websites out, it's really become very accessible to everybody. And I think in the last few years, it's really gone, the levels of procedures, especially in a down economy that we've had since 2008, the shift to non-surgical procedures especially has increased, because it fits someone's capability of having a less expensive procedure with less downtime.
We also know that you provide medical surgery in the transgender community.
Yes.
Talk about that.
Yeah, so the transgender community is a community that I feel a very kind of close affinity for, because these patients are some of the most satisfied patients and excited patients after their surgery. And I specialize not only in gynecomastia, but also transgender surgery above the waist, so female to male as well as male to female. And these patients have remarkable stories of perseverance, and some of them have come from either lack of support or no family support or social network. But others come in with full support. And I'll tell you this, the day of the reveal, when I reveal the outcome of the surgery, usually about 6-7 days after surgery, is one of the most emotional times, not just for the patient, but for myself as well. It's one of those things where you feel like you're really making an impact on the trajectory of somebody's life. And even more so than certain other procedures like injectables or certain other surgical procedures. You really feel like you're finally letting this person look on the outside how they've always felt on the inside. And you just can't put words to that sometimes, how impactful that is.
From a humanity standpoint, that must make you feel good.
Absolutely, yeah. As a plastic surgeon living in Los Angeles and working in Beverly Hills, I'm still always striving to redefine the importance and value that I have for my fellow person. And I think that that's one of those things that when I do that surgery, it kind of reinstills that I am doing good, and I'm making people's lives better, the quality of their life better.
Kybella is a new surgical procedure that your office provides. What exactly is that?
Yeah, so Kybella is actually a non-surgical procedure,
Okay,
but yeah, it's relatively new and it's targeted for a very specific area of the body, namely the area, the fat pad underneath the turkey gobbler, the double chin, whatever you want to call it.
I don't have to
Yeah.
do it.
No, you look fantastic. You don't need that at all. But really what it is it's an office-based procedure where a patient comes in, little numbing cream here, and then a series of injections of this medication that can dissolve the fat cells. And it's basically to avoid a surgery. And the results don't happen right away. They can take a little bit of time to take effect. But again, like most things in plastic surgery, selecting the right patient and the right candidate for it is what instills that you're going to have a successful outcome.
As we prepare to close, we know there's an increase in men receiving plastic surgery. What do you see the future of the specialized medical field being?
I think the future is partly going to be more of the same, so more of an increase in men having procedures. I think specifically in what I do, I think men are going to start doing it at a younger age, for one. I still see a little bit older male demographic coming in for some of the rejuvenation stuff, as opposed to, say, women starting even in their 20s. Men tend to start a little bit later. I think that's going to change. I think men are going to start coming in earlier and earlier. I still am a big believer that protecting your skin, meaning sunscreen and avoiding a lot of things that can damage your skin, smoking, is always the best foundation. But I really think that the trend in male plastic surgery is going to be not just having more procedures, but at a younger age as well.
What do you tell African American men and men with more hue or melanin in their skin? I know sometimes, just talking to my friends about speaking with you, the issue of keloids comes up and scarring comes up in terms of having medical procedures done. What do you tell?
Yeah, that's a great point. That's probably one of the most common questions I get asked. Obviously, in a practice that's very male-dominated too, I see men of all different ethnicities, but I see a lot of male, not just African Americans, but also Middle Easterners, Hispanics, people who are darker toned. And I think one of the biggest concerns is how are they going to heal? And yeah, maybe historically, people of darker skin tone, African Americans, may have a slightly higher chance of having keloids or hypertrophic scars, but it's not seen. I actually show patients, especially African Americans, my before and afters of African Americans. They tend to heal even better. It's amazing. The incisions, especially for gynecomastia, for instance, they heal exceptionally well. And I really go to great lengths to reassure them that this should not be an issue that they need to worry about. The risk of keloid is exceptionally low in the general population anyway. And the reason why I feel like these incisions heal very well are one, they're made in a very precise fashion. They're closed under very little to no tension. And I just tell patients not to be too active in the first couple of weeks, to not put too much tension on the incisions. They heal fantastic. I've never had to revise one of my own gynecomastia incisions.
Thank you, Dr. Dadvand. Appreciate it.
Oh, it's my pleasure, Michael. So one of the most common things that men come in for is for fine lines and lines on their face. Let me have you do a couple things for me. Raise your eyebrows up all the way. Yeah. And you can see there are these lines that occur on your forehead, and even when you're relaxed, those lines are still there. And so a great treatment for that is Botox. And you can do Botox without necessarily freezing their face. I mean, everyone's always worried about looking frozen and having no expression, but Botox can be done very delicately to smooth out the forehead, but also allow you to maintain expression.